dentistry had changed from need-based to want-based.
Yes.
And I have seen that in the past decade, it's like changed leaps and bounds.
Yes. If you're an ethical dentist, then you know what you want to prescribe to a patient. The beauty of technology, specifically in terms of aligners, is that it has democratized this technology, and we can provide this service to almost anybody.
Patient who comes in, they need any kind of treatment, the first thing that plays on my mind is that would I do this on myself or on my parents or my spouse? Would I do that on my child?
But when we do cosmetic dentistry, I always say that this is a collaboration with the patient.
Yeah,
So you get to give your inputs at different stages of the treatment.
Hello everyone. Welcome to Confessions of a Dentist, episode 4. Today we have Dr. Manav Kalra with us, who is not only a very influential prosthodontist and a cosmetic dentist, but also a great educator in his own right. So welcome, Dr. Manav. Welcome to Confessions of a Dentist. And today's episode is super special because we would be diving deep into how technology has shaken the face of dentistry and a lot about smile design and biological cause. So I'm really excited for this episode.
And you should mention that we're really good friends for a long time.
Very, very long time, yes. Till we know, yes. So let's start with a topic which is close to both our hearts, cosmetic dentistry.
Absolutely.
And with the whole face of Instagram and social media, I've seen a lot of patients want to look better. So dentistry had changed from need-based to want-based.
Yes.
And I have seen that in the past decade, it's like changed leaps and bounds.
Yes.
So is there a particular trend that you see in India that like there is to do with smile design? Is there something that is...
Absolutely. You know, people have more disposable income as people want to look better. A huge demand for aesthetics, cosmetic dentistry, aligners, and all of these so-called elective procedures, right? This trend has been is worldwide. And we're seeing a significant portion of that also happening in India now. I myself have tried to position myself as a cosmetic dentist to actually cater to this demand. So we have so many patients who are coming from, let's say, Europe and other places where they don't know that in India also we can provide that high quality or even better quality services at a relatively more modest pricing than in these countries. So there's a huge wave, and we are, we're ready to service that industry. Yeah. And we're seeing a huge demand in cosmetic dentistry. It's not just cosmetic dentistry; it's also a lot with aligners.
Yeah.
And
I have seen that a lot of people are okay to get orthodontic work because
Yes.
initially there was this taboo that no, I'm of a particular
Yes.
age and now I don't want orthodontic treatment.
we don't even call it orthodontic treatment. Now we just
Yeah.
call it aligners.
Yeah, we just call it
Yeah, it's
aligners,
just
yeah.
aligners. And the beauty of, you were touching upon technology, the beauty of technology, specifically in terms of aligners, is that it has democratized this technology, and we can provide this service to almost anybody.
Yeah.
Right? And it's much easier. The costs are much lesser.
Yeah.
The treatment is more precise. It takes less time. It's less painful. And of course, as you know, aligners are a lot more cosmetic, and they're
Yes.
you can remove them. It helps in oral hygiene.
Yes.
So it's just a win-win-win-win situation.
Yeah.
Orthodontics and braces were just too cumbersome for a patient.
Yeah.
Especially for adults. Children, I mean, I've got braces. I had braces for 3.5 years.
Yeah.
So
Same,
I know
had.
that. Yeah.
For 2 years I
yeah.
had, but it
Yeah.
was quite a cumbersome
So I know
procedure.
that from a point of view of a dentist, but I also know that as a point of view from as a patient, because
Yes.
I experienced that.
Yes.
And now just things are just so amazing.
Yeah.
And
So even like with lingual braces, the braces which are from the inside,
Yes.
people of a like older age are also okay with getting like braces
Yes.
done. And aligners also, like the treatment time as compared to like a cosmetic work, for
Yes.
example, like veneers would just take 2 appointments and it can be
Yes.
finished in about a week's time.
Yes.
But with aligners, I've seen that even if it's a 8 to 10 month procedure and the retention phase,
Yes.
patients are still okay to get it done unless they have like a function like their wedding which is in a month.
Yes.
Then they are like, okay, now we don't want aligners because we have short on time. So you do see that more people are tilting towards aligners or veneers, or you see that it's
No,
equal.
that depends on the dentist. If you're an ethical dentist, then you know what you want to prescribe to a patient. An orthodontic patient or a patient who requires the teeth to be moved in a correct position is not typically a veneer patient.
Yeah.
And many times in our practice, we will first put our patients through an orthodontic phase or what the
Yes.
aligner phase,
Yes.
and bring them to a place where they are now a good candidate for veneers.
Yes.
So
Yes.
that we can segue straight into what you were mentioning earlier, which is the biological cost, right?
Yes. Yes.
So the way I tell my patients is that, look, there's two costs to a treatment. There is a financial cost and there's a biological
Yeah.
cost. You pay with your wallet, but you also pay with your enamel and the tissues which will not grow back.
Yes.
Money comes, money goes, money comes again.
Yeah,
But once a
but-
tooth is cut, it doesn't
Yeah,
come
it
back
doesn't
again.
come back. Yeah.
So it's really important to understand that what is the actual full cost of the treatment.
Yeah. I think and it should be stressed upon.
Yeah.
People don't stress about it, and that's why I really wanted us to
Yes.
touch on this topic in this podcast, because yes, there are aligners, and your dentist is going to push you whether you
Yes.
want to get aligners done or like you should go aligners before veneers done. But people who come for veneers or
Yes.
smile design, they don't have knowledge that
Yes.
what is a subtractive case, what is an additive case.
Yes.
Generally, as dentists, what it basically means is additive cases that we need to add more.
Yes.
We like to do, because we do minimally invasive work, we like
Yes.
to add more to it. So if there's a gap in the tooth or the teeth are like,
Yes.
relatively aligned, we're happy to do veneers first.
Yes.
But if it's a crowding case in which the canines are buckly out, like more
lip- the
outside.
lip, yeah.
Yeah. So then we would want to get the
Yes.
aligners in first, or like the ortho
Yes.
first, and then. So,
Yes. So I mean, I'll just explain. I'll explain that in a different way.
Yeah.
What happens is, not everyone is a good candidate to get veneers. Like, patients will see, or people or the public is just going to see some stuff on Instagram. They say, "Listen, I want veneers. My friend got veneers. I want veneers." But when you come to a cosmetic dentist who knows what they are doing, they might just tell you that you are not a good candidate for this procedure. So let me give you a typical example of somebody who's not a good candidate. If someone feels that their teeth are too bulky, if someone feels that their teeth are too big in their mouth, you are automatically rejected from doing veneers, because any kind of veneers is adding material. And when you add material to teeth that are already bulky or long or crowded, like you said, those are typically bad cases for veneers.
Yeah.
Now, in some instances, like you said, we can put aligners on to straighten the teeth, to push back the teeth, and then you could potentially become a good candidate for veneers.
veneers, correct,
Right?
yeah.
And in many instances, I've seen this in personal experience as well, is that when you finish the aligner treatment, the patients or the client is so happy with the way they look,
Yeah.
they may or may not want
Yes,
veneers.
that's correct,
And
yes.
if they don't want veneers after that and they're really happy with what we've done for them, then the biological cost, so to speak, is zero.
Yeah.
Right? We haven't touched the tooth at all.
And actually, when you decline such treatments, I've seen patients be like, why? Like, why is she declining treatment?
Yes.
Why is there that they don't know how to do it?
Yes.
And, so you're like, no, we know what we're talking about, and this is not required. And you might be happy, and they're not used to dentists saying, ki, okay, this is not required, and which is so important in our profession,
Yes.
because that sets trust in the patient.
Yes.
And a patient, even if the patient sometimes pushes like, no, we want.
Yes.
So it is okay for us to decline
Absolutely.
work, because you need a good night's sleep. You know that
yeah.
if you've done something which is not completely ethical, I mean, I lose sleep in the night.
No, you just say that if this was me,
Yeah.
or this was my sister or my mother or
Yeah.
somebody, I would treat it like this.
Yeah. So-
And that's
yeah.
then if they after that, if they don't trust you, then they're not the patient for
Yeah,
you.
correct.
Right?
So in Dawson, they taught us the Vidium rule,
Yes.
which is, would I do it on myself? So
Yes.
the entire treatment plan is
Yes.
based on the Vidium rule.
Absolutely.
Yeah. So Vidium rule is what I learned at Dawson Academy, and what it stands for is, would I do it on myself? So whenever there is a patient who comes and they need any kind of treatment, the first thing that plays on my mind is that would I do this on myself or on my parents or my spouse? Would I do that or on my child? And that's how the treatment is planned. So it just makes it easy because as a dentist, we have to give different options to the patients. It's not that, okay, if it's just a straightforward that, okay, there's a cavity, there's a caries on your decay on your tooth, and you need a filling, yeah, there are no options. But if there's a more comprehensive treatment in which whether there is any alignment which is required, whether there is any implant procedure, root canal, or even like those crowns, onlays, in basically any treatment which is required, it's just better that we speak to the patient that these are the 3-4 options that you have. You can choose it from there, and the options are based on the fact that would I do all these procedures on myself? Would I want to do all 4 procedures? Out of all the 4 procedures, would I want to do it on myself? And it is not a biased opinion. We don't need to tell the patient that, okay, these are the 4 options, but I will do the first. Let the patient choose. The intent is from a place of empathy, not just like a business model in which we just need to churn how much procedures we've done. So I think that's very, very important in our field.
Everything that we do in our practice is based on that,
Yeah,
right?
yeah.
We don't. And in fact, if you ask, so I also teach porcelain veneers, as you
Yes.
know. So if you ask some of my participants who've attended my program, I always tell them, listen, you're here to learn how to do ceramic veneers or porcelain veneers. But if you, as a private practitioner, want to practice ceramic veneers, you cannot do that if you do not have an extensive knowledge of composites and if you don't have an extensive knowledge or at least treatment options in your practice, that is aligners. So if you don't have aligners on one side and you don't have composites on the other side, you cannot do a successful cosmetic dentistry practice because all three of these factor into what I consider the umbrella term, which is
Yes.
cosmetic dentistry.
Yes.
And
Yes.
this creates an ethical environment for you to work.
Yes.
Because if the patient needs composites, you can quickly switch to composites because you have that happening in your practice every day. If the patient needs alignment, you can quickly shift to aligners and then do a combination or individual treatment.
So I think with dental education also, like we even if we whenever we do a continuing dental education course, we always feel that we should have a case for this, which is true, but it's I mean, I don't know the chicken or the egg, but sometimes when we do a course, we start looking at patients in a certain way that, okay, does this qualify? But what you said is completely right, that you should give a like treatment option, like an entire
Yes.
umbrella. Okay, now this is what I feel.
Yes.
These are the options, and this is what the patient can choose from.
Absolutely. And I keep, and again, I'm coming back to what we do in our program, but I actually have my aligner consultant
Yes.
doing a lecture in the porcelain veneers program because I want them to also do aligners.
Oh, that's
You
very good.
cannot do ceramic veneers without knowing composites and
Yes,
aligners,
that's great.
essentially.
Yeah. So when we're talking about biological cost, do you also because I keep telling my patients that after root canals, crowns are not required.
Yes.
I mean, not there's something which is required. A restoration is required, whether it's a crown, whether it's an onlay, any restoration, because root canal is purely just taking the disease out of the mouth. So root canal, whether it takes a single sitting or 2 sittings or 3 sittings, is only going to take the disease out. It is not going to make the tooth functional to take your bite load for.
Absolutely.
So do you want to just talk a little about what should we do post a root canal, talking about the biological cost?
Yes, of course. Okay, so basically, what happens in a root canal? In a root canal, the endodontist or the person who's performing the root canal has to drill right in the center of the tooth to access the roots or the canals inside those roots.
Yeah.
Now, when the endodontist or the dentist is drilling into the tooth becomes hollow. And that makes the tooth weak, along with the fact that if there was already a cavity in it. So the old cavity plus the dentist has drilled some more,
Yeah.
the tooth becomes weak, it becomes hollow. So once the root canal treatment is completed, you need to protect this tooth.
Correct.
Okay. Now, traditionally in the past, we would protect this tooth by cutting all around the tooth and putting what we call as a crown, which goes circumferentially 360 degrees around the tooth.
Yes.
Now, this is a great option if the tooth is very badly damaged. And still today, it's a great option
Yeah.
if the tooth is severely damaged.
Yes.
However, in, I would say, a large, vast majority of cases, you do not need to drill the entire tooth down to a stub. You can do something known as a ceramic onlay,
Yes.
which only is placed on top of the tooth, and there isn't a significant amount of reduction on the sides of the tooth.
Yes.
So what we say is the life expectancy of the tooth after the root canal is dependent on how much tooth structure is still left around.
Yes.
So you have to preserve as much tooth structure around the tooth so
Yes.
that the tooth can last much longer.
Yes.
And with adhesive technology, with the kind of bonding technology that we have, with a lot of other advances, we can do almost 90 to 95% of cases after root canal, we can do with a ceramic onlay instead of a crown.
Yeah.
So this is something which I would like a huge number of people to know.
Yeah, yeah.
Once you've gotten a root canal, you do not necessarily need a crown. And if your dentist is asking you only to get a crown, you could consider getting a second opinion
Yeah.
and probably preserving some more of your tooth structure and prolonging the life of that tooth.
Yeah. And also, I want to add to the fact that people should know that if it's an only doesn't mean it's cheaper.
Yeah.
It's the same price.
Yes.
And it's the biological cost that we are saving. So
Yes.
it's not the financial cost that, oh, the procedure is lesser or any of that. It takes the same amount of time. It takes all the same amount of material from the lab. The financial cost is the same. The biological cost is
Actually, it's more expensive sometimes because the
it's
materials
more,
are more
yeah,
expensive.
yeah.
And so it's a funny thing that we joke about, right? Like a veneer or a onlay.
Yeah.
They say, yeah, you're giving half a crown for double the cost.
Yeah, yeah. But we're saving
So-
the biological
Yes,
cost, which is
yes,
what like
yes.
this is like this segment is supposed to stress upon. So thank you for like
Of course.
putting this out there.
Okay, so what are ceramic veneers, or what are veneers in general, right? Veneers are thin shells of ceramic that are placed on top of your original tooth, and this is used to change the shape, the color, the size, the texture, or if you have gaps, and of course change the smile line. You know, like that beautiful Colgate smile line that goes parallel to your lower lip. So we can do all of these things with ceramic veneers. But ceramic veneers are not the only option, right? If you have very small, specific issues, let's say you have a tiny gap between your teeth, or let's say that you're an older individual and the gums have kind of shrunk and you have these ugly or less than optimal black triangles between the teeth that need to be covered. So if you have these tiny little issues, then composite veneers are a much better option than ceramic. So the way I like to explain it is, if the amount of correction is less, then composites are a better option because they are faster, they are cheaper, they can be less invasive, and they can last a really long time if it is done properly and if we have figured out exactly where it needs to be used. So smaller damages and smaller changes, composites, and larger changes, ceramics.
Yeah.
So Ishita, what do you think? I mean, where do you? I know you do a lot of composite veneers
Yeah,
as well.
yeah.
So where do you feel ceramics also play a role in your practice, and how do you decide what to give?
So we all yeah, you're right that we do a lot of composite restorations, and you're right on the fact that there are whenever the changes are lesser, it's always better to do composites. But I
Yes.
have also done a lot of composite cases in my full mouth rehabilitation cases.
Excellent.
Because I feel as you said that composite is also like a more forgiving material. It lasts much longer. Yes, the quality of ceramic is much higher, so more polishability is there in ceramic. So if there's just a basic smile design case, and with the kind of patient who says that I don't want to come again and again, I'm not okay with the fact that you was telling me that composites might stain a little bit over a period of time. I just want one. You all people who are in the show business who just want results and they don't have any problem in terms of finances. I'm like, you close your eyes and just give ceramic veneers. But we do treat a lot of patients who are from Smile India who need veneers, who have broken, like children from homes who have broken their teeth, even our private patients, non-Smile India patients. I feel that if there's just a fractured tooth,
Yes.
and a patient who's definitely below the age of 18, or even proper cases like full mouth rehabilitation cases in which I feel the bite is such that I would be more comfortable if we can just keep composite veneers or composite restorations for a relatively longer period of time and then probably switch them after a few years or not switch them at all. It's a choice of the patient if they feel that, it's not looking nice after 10 years because over a period of time, anything in dentistry tends to break down. It's not that you give something and that's going to last you for your entire life. So I feel that we can keep upgrading, and that is the reason why I prefer composites a little bit more than porcelain veneers
Right.
or porcelain restoration. Porcelain, I'm saying ceramic restorations, ceramic
Yes.
veneers and ceramic restorations.
One of the biggest advantages of ceramics is also that since it's made in a lab by a lab technician, the overall aesthetics and the cosmetic look of ceramic is unmatched.
Yes,
And
definitely.
so there's that difference also. So you need
Yes.
to. I think we need to also sit down with the patient and really give them all the options and make them understand the advantages and disadvantages of
Yes.
both materials,
Yes.
and then
Yes.
come to a common agreement on what is needed.
Yes. And for composite veneers, also as a dentist, you need to really train yourself.
Absolutely.
I do know that you teach ceramic and you need a
Yes.
lot of training for ceramic also with the
Yes.
entire bonding protocol. But in terms of like aesthetics, in terms of fabricating a veneer,
Absolutely.
I feel that composite is more like time intensive. I know there's a huge cost difference between composite and like ceramic veneers. Like ceramic, so that's the reason why like people who can't afford too much go in for composite. But I feel from a dentist point of view, the amount of effort that is put in fabricating a composite is much higher than
Yes.
a ceramic,
Yes.
and we should try to compensate. We should try to not have such a huge difference between composite and ceramic, but I feel that, but it
Yeah.
is what it is. Yeah. So Manav, minimally invasive dentistry is the key to success, and you know l- less is more in cosmetic dentistry or in any dentistry. We use, both of us use digital scanners, and the number of appointments and the kind of work in terms of precision and predictability both have really improved. Do you think our patients know that, like the behind the scenes? Would you want to add something to it?
Well, can cosmetic dentistry can be more vastly applied to a significant number of people precisely because now the invasiveness of the treatment has gone down, right? So if you don't have to cut down teeth to make someone beautiful, then more number of people you can treat ethically. So yes, there's techniques that have improved. There's technology that's improved with 3D printing and digital designs in software. So there's huge advances in software. We're all using softwares like Exocad, etc., where you can really get the mock-up and the design even before you start.
Yeah.
So there's a huge shift in predictability as well as the precise nature of the treatment.
Yes.
And with higher, with better results and less invasiveness of the treatment, you can actually end up treating more patients. Whether
Yes.
more patients actually know about this or not, that's not. I don't know if that's relevant. At the end of the day, if they're getting better service, then we can do more patients essentially.
Yes. Yes.
You
In
know.
the same number of hours.
Yes,
Yes.
exactly. So they don't
Yes.
need to know the inner workings of what's happening, but yeah, dentistry has benefited hugely from advances in technology in various different fields, right?
Yeah.
So you have 3D printing, you have milling, you have intraoral scanning, you have photogrammetry, you have all kinds of amazing things.
Yeah.
You have advances in magnifications.
Yeah.
So there's a there's a whole different world out there,
Yeah.
and technology is unrecognizable. I mean, dentistry is unrecognizable
Yes.
because of the technology that now
Yeah.
exists from just say 10, 15 years ago,
Yeah,
right?
because when we came back from college, till very recently, the whole shift was we have to take impressions. So the
Yes.
patient did not like, and there was this whole gagging reflex which used to happen. And
Yeah.
then finally we did take the impressions, and then we sent it to the lab. Now, if the lab is not in Delhi, You courier it, so then there
Yeah.
are 2 days gone there.
So essentially, what we are saying is that, like, if we have to make something that has to be put in your mouth, we have to make a mold, and many of our listeners know that sensation of having that material set and
Yeah.
harden in your mouth.
Yeah.
So that stuff is now
Yeah.
obsolete, and
And
we just
I
take a
also
photograph.
had issues that we used to send it, and then after 2 days, it used to reach Bombay, where we like to send most of our work to. And they were like, oh no, there is some problem with the impressions, it's not clear, and all. And then you call the patient back and redo it. So there was
Yes.
a lot of unpredictability in terms
Yes.
of work, I feel. Now
Yes.
you just email it, they check it there and then. They're like, हाँ इसको change कर दो. You change it, you send it back. So and
Yes.
time is faster.
Yes, the workflow between the lab and the clinic becomes much faster
Yes.
because now we have a scanner which is immediate, just like an email.
Yes.
So, yeah.
Even the design which you were saying, so like
Yes.
now the crowns are designed like we have a same app of the lab, and the lab sends us the design. We just see the design on a like it's a 3 dimensional thing that we can probably show it on the video also. And if there are any changes that we need in any implant crown, in any veneer, we don't like the way it's looking, the shape of it, we can just tell the lab there, and then they'll edit it and they'll send it back to us. And then once we approve it, only when they'll print it, design it, and send it back to us. So I just feel that is so cool.
Yeah.
Yeah.
No, I mean, so another way to just talk about that is that when we design a smile, when we make veneers, those veneers are actually designed on a software initially. So a lot of that designing is now aided by AI, right? So
Yeah.
these softwares have AI integrated. They have different libraries of different designs of different smiles. So if you like a celebrity smile, we can probably copy that as well.
Yeah.
Not
It might not look
it
the
might not look
same on
great.
you,
Yes.
yeah, but at least, yeah,
Yeah. So we have a lot of copy paste dentistry that happens, uh, which is a good adjunct to the technical skills of the ceramicist and the dentist.
yeah. And also, once we have that design, we can put it like a mock up inside your mouth. You don't have to
Yes.
be like, oh, this is the design, because what you see on the phone or on the screen and what you feel inside your mouth is very different. So we can kind of put it as a mock up, like it's a temporary fix. And if you see and you like the way it's looking, then we can change it to like a permanent thing. But once,
Yeah, that's an interesting point that you made. I have this conversation with my patients all the time, right? So sometimes some of my patients have already been to another cosmetic dentist, and he or she has shown some Photoshop version of themselves before and potentially after treatment.
yes,
Now, I am not a very big fan of that because you can Photoshop anybody to look like anybody, and that's not a realistic expectation of treatment.
yes,
So I don't use any of those softwares that simply just
simulated.
simulate an output. Instead, what we do, and I know that you do that as well in your practice, is we do something called as a test drive.
Yeah.
We actually get a design made for you on your scans, and then we transfer that design into your mouth,
So that
and
you
then
can
you can
see.
take a selfie of yourself and then see how you
Yeah.
look.
And you can
Right?
feel it how it's
Yes.
feeling inside the mouth.
And the advantage of that procedure is, the advantage of the test drive is that is a real representation or a very close representation of what you can expect at the end of the treatment.
Yes.
Whereas when we again compare it to that simple photoshopping of a photograph that you already have,
Yeah.
that's not realistic, and that may or may not be possible in the treatment.
Yeah. And also in the test drive, if you don't like the test drive, it can be edited.
Yes.
And then we can rescan it and send it to the lab that, okay, the patient did not like this and the patient likes this. And then we can change that also.
Yes, I always tell my patients, so there's two types of dentistry. One is the root canal and extractions and all of that, where I am telling the patient, listen, this is in your best interest. This is how we should do it, and this is how we'll execute it.
Yeah.
But when we do cosmetic dentistry, I always say that this is a collaboration with the patient.
Yeah,
So you get to give your inputs at different stages of the treatment.
Yes.
So the first input that the patient gives us is at the test drive stage.
Hmm.
Then at when we give them a temporary veneer, and we give them that temporary veneer for a week, 10 days for them to wear it at home. So that's the second time they get to tell us what they like and what they don't like and if there are any changes. And then there's a third time when the veneers finally come back from the lab and then we put them on your teeth. That is the final look that we are wanting to give you. And at that stage also, the patient or the client can give us feedback. And then if there are any changes that are required, the work can then be sent back to the lab, a bunch of photographs taken, and then brought back, and those corrections can be done. So
all that before we cement the
yes.
veneers.
So there are 3 different times when there is a feedback or an option of a collaboration with the patient. To make sure that their expectations are met and we're not going in a parallel direction.
Yes, correct.
So Ishita, I know that you just came back from ISB and you did a degree in leadership in dentistry.
Yes.
And I'm really excited to know what that was all about and what we can learn from you without having to go to this fancy university.